안녕하세요, 아이린님. 오늘 학교 수업해야 되니까 짧게 원서를 읽고 그리고 루틴하고 학교 한번 가보도록 하겠습니다. Write out reasons for which you grateful. I could, but a gratitude I would. The benefits far outweigh almost all the medications I prescribed without side effects. A wealth of research suggests that a daily practice of gratitude, which can be as simple as writing down several things we are grateful for every day, can improve our emotions, habits, relationships, and personalities and careers. Happiness, well-being, mood, self-esteem, resilience, sense of spirituality, impulse to give, autism, reduction in materialism, reduction in self-centeredness, recovery from substance misuse, resistance to stress, resistance to envy, friendships, love relationships, career networking ability, productivity, goal achievement, reduction in turnover, decision-making among physicians, physical health, including physical appearance, better sleep, fewer physical symptoms, more time exercising, less physical pain, low blood pressure in people who are hypertensive, recovery from coronary events, vitality and energy, longevity. Focusing on gratitude has been found to increase the activity of the parasympathetic nervous system and decrease inflammatory markers, improve depression, stress, and happiness. Reduce stress among caregivers and among elderly. Significantly decrease state anxiety and depression, as well as increase specific memories, life satisfaction, and subjective happiness. When you make a habit of bringing your attention to the things you're grateful for, you enhance how your brain works. In times of stress, take a minute to write down 3 things, big or small, you're grateful for. Share a gratitude letter. Write a 300 essay about someone you're grateful for, such as teacher, mentor, friend, boss, or a co-worker. When you have finished, if possible, make an appointment with that person and read the essay aloud to him or her. Research has shown that doing a significantly increase the life satisfaction scores and the happiness and decrease the symptoms of depression. Express your appreciation to enhance gratitude and appreciation, which is gratitude that is a word expressed and builds bridges between people. Expressing support and appreciation to others has been shown to decrease the stress response in the brain much more powerful than receiving support. It is better for your brain to give than to receive. To surcharge joyful thinking, get in the habit of writing down the name of the one person whom you appreciate and why, then share your feelings with the person with a quick email, text, or a call. Do this once in a week, and try not to repeat anyone for 2 months. This exercise will help you build many bridges of goodwill. Count your blessings. You can boost your good feelings if you count your blessings instead of sheep at night. In a study of 221 teenagers, the group that focused on continuing their blessing reported increases in gratitude, optimism, and life satisfaction, and a decrease in negative feelings. At bedtime, write down as many good things in your life as you can think of in 3 minutes. Note down the what went well. Another exercise that has been shown to quickly increase your level of well-being is called What Went Well. What went well? What went well? Research has shown that people who did the exercise were happier and less depressed at 1 month and 6 months follow-ups than the study of offset. Write down 3 things that went well that day, then ask yourself, why did it this happen. This simple exercise has been fun to people, help people in stressful jobs to develop more positive emotions. She played the article over and over in her mind. She had an obsessive pattern in her brain where she tended to get stuck on negative thoughts and behaviors. Her first homework assignment was to write out her accomplishments in as much detail as she liked. At her next session, she brought 8 pages full of accomplishment. Write down the highest and the most positive moments of your life. If you can find one moment as I'm sorry. If you find one moment as or you can find two. If you find the two, you will likely find four and so on. By bringing your attention to your successes, you are much more likely to feel better fast. Yet, this is where it gets exciting. About the 1/3 of people in Group 2 who had been unable to escape the pain never became helpless. Why? The answer turned out to be optimism. Dr. Sherman's team discovered that people who do not give up interpret the pain and the setbacks as temporary as opposed to permanent, limited instead of pervasive, changeable instead of out of control. Believe that teaching optimism can help inoculate people against anxiety, depression, post-traumatic stress disorder, and relationship problems. Here are some of his main ideas. Listen to yourself and others to see how things are explained. Are the people powerful or victims? Do they have control or no control? Are hardships permanent or temporary? Oh my god, my dog is just sneezing. He has a really deep, sweet sleep now. While optimists describe things as just in reverse, the bad as temporary and the good as permanent and pervasive. Change your language and feeling around the situations you face. You can't stop being a victim. Take control wherever possible and understand the hardships are usually temporary. 3. Allow mistakes and learning experiences rather than final judgment on your self-worth. Everyone makes mistakes. It's how you respond to them that determines how quickly you recover. Accepting a mistake and then looking for the lesson you can take away from it will help you get over it and move on. Oh my god. Focus. Hiding. Focus. Optimists feel hopeful. See problems as temporarily. See problems as limited. See personal control or influence. See failure as a lesson. Feel self-confident or forward-thinking. Tend to be hopeful. Tend to stick with difficult things. Are more proactive with health. Forgive more easily. Are less likely to dwell on negative. Feel less stressed. Are more likely to sleep better. Seek less as helpful. Are more altruistic. Strive to take control of your life and be forwarding thinking and see possibilities. Optimists that have significantly lower heart disease than those who were pessimistic. Women who scored high on cynical hostility were also more likely to develop contrary heart disease. Optimism is also associated with a higher quality of life, a lower incidence of stroke, improved immune system function, better pain tolerance, and no longer survival in lung cancer patients. Accidents and preventative illness. Being sleep deprived led to increase the optimism and the poorer life choices. College students who were too optimistic had a more binge drinking behavior, and the compulsive gamblers were often rated as too optimistic. The bottom line, it is always best to balance optimism with the planning for and the preventing future trouble. We are not controlled by events or people, but by our perception of them. Perception is the way we, as individuals, interpret ourselves and the world around us. Our five senses takes in the world, but perception occurs as our brains process the incoming information through our feeling filters. When our filters feel good, we translate information in a positive way. When our filters are angry or hostile, we perceive the world as negative toward us. Our perception of the outside world are based on our inner worlds. When we are feeling tired, for example, we are much more likely to be irritated by a child's behavior that usually doesn't bother us. Our view of a situation has a greater impact on our lives than the situation itself. Our perceptions bear witness to the state of mind. As we think, so do we perceive. Therefore, in reality, we need not seek to change an outside world, but rather to change our inner world. A is the actual event, B is how we interpret and perceive the events, and C is how we react to the event. Other people or events A can make us do anything. It is our interpretation or perception that causes our behavior. When we can allow ourselves to look at our alternatives and challenge our initial negative perceptions, we've traveled along the way toward emotional health. It's no exaggeration to say that developing accurate, honest, and disciplined thinking can change our life. If you get rid of ends, practice gratitude, manage your perceptions, and follow these other strategies, you will see a decrease in worry, anxiety, anger, and negativity, and be on your way to feeling better fast. Eliminate ants as they attack. Stop monkey mind by paying attention to it. Start every day with the phrase, "Today is going to be a great day." Record your moods and look for ways to increase gratitude. Create optimism with a dose of reality to build resilience better. Each of these habits take no more than a few minutes. They are anchored to something you do or think or feel so that they are more likely to become automatic. Once you do the behaviors you want, find a way to make yourself feel good about them. Draw a happy face and palm your fist, or do whatever feels natural. Emotion helps the brain to remember. When my feet hit the floor first thing in the morning, I will say to myself, "Today is going to be a great day." After an ant pops up, I will write down my negative thoughts and ask, "Is it true?" After I get home and put away my keys, I will push play on meditation audio. Before I go to bed, I will count my blessings, listening at least 3. After I have negative thought, I will think about what went well that day. When I face a difficult situation, I will ask myself, "There is there to be glad about in this situation." After breakfast, I will think of one person I appreciate and reach out and tell him or her in a quick text or note. Feeling connections. A couple can have a stable and a happy relationship over time. Truth is, everybody's going to be hurt you. You just ain't gonna find ones worth suffering for. Good relationships keep us happier and healthier, according to a 75-year longevity study from Harvard University. Positive social connections helps us live longer, while loneliness kills us early. Being in a positive, warm, satisfying relationships keeps our brain and bodies healthy into older age, while being in relationships filled with conflict is associated with sickness and early death. Emotional crisis, panic attacks, depression, and obsessive behaviors are often triggered by the loss or threaten the loss of a relationship. marital problems, affairs, domestic violence breaks up. All of these relationship problems that prompt people to come and see us in MN clinics. Improving your social connections is one of the best ways to start to feel better fast and make it last. Unlike polar bears, humans require social interactions to stay healthy. Have a fundamental need to be belonged. That's just as essential as our need for food and water. People who are socially connected are happier and healthier, and they live longer. Being a loving relationship is every bit as important as sleep, a healthy diet, and exercise. This is just an individual. It should be individualized. Okay. When your brain is healthy, you can perceive others more accurately, have good control over your emotions, and act in a healthy way that brings people close to you. Your brain allows you to read the social cues, listen, respond appropriately, deal with conflict, set effective boundaries, act inclusively and attentive in the moments of interaction. Understanding the neuroscience of relationships will give you an uncommon advantage. As you care for your brain, all of your relationships are likely to improve. However, if the couple communicates respect and the shared purpose and stops escalation in a civil way, the future looks much more positive. Enhancing interpersonal skill has been effective in reducing anxiety, depression, and stress, and in improving both business success and marital satisfaction. Responsibility, empathy, listening, and good communication skill, appropriate assertiveness, actual physical time, inquiry and collecting negative thoughts, noticing what you like more than what you don't, grace and forgiveness. I have the power to improve how we communicate and act toward each other. I have influenced my relationship direction in a positive way. I am responsible for my behaviors and our interactions. I don't think it's all your fault, but I think you have contributed to your troubles in more than you give yourself credit for. And if it is true that we've contributed to your problems, then you can do things and change them. As long as you stay innocent victim of others, there is nothing you can do to help yourself. Either way, I need to learn how to respond effectively to whatever situation I am in. Responsibility means you have the ability to respond in a positive, helpful way. Taking responsibility in relationships means continually asking yourself what you can do to make the relationship better. What can you do today to make your relationships better? You win more in relationships when you ask yourself this question and stay away blaming others. And encourage the tendency to think always in terms of other person's point of view and see things from that person's angle as your own. Researchers have found that children with autism who often display social skill deficit have problems in their mirror neuron systems. This system is important to empathy. When it is healthy, we can experience the feeling of others. When the system works too hard, we can become too sensitive, which will make us terrible doctors or nurses, as we could be crying all the time is responsive to others' pain. When it does not work hard enough, we could hurt others, and they would bother us. As is true with so many parts of the brain, a healthy system helps us most. Empathy helps us navigate the social environment and answer questions such as these. Is this person going to feed me, love me, attack me, faint? Okay, run away, cry, the more accurately we can predict actions and the needs of others, the better off we are. The ability to tune in and empathize with others is a prerequisite for understanding attachment, bonding, and love, all of which are important for our survival. Insensitivity to others or lack of empathy was cited more than any other flaw as a reason for the derailment. Balance is the key. When negative behavior comes your way, ask yourself two questions. Developing empathy involves a number of important skills, including mirroring, treating others in a way you would like to be treated, and being able to get outside of yourself. The following three exercises are designed to help you increase your empathetic skill. Your ability to understand and communicate with others will be enhanced by learning what therapists call the mirroring technique. You can use this technique in many interpersonal situations to increase rapport. When you mirror someone, you assume or imitate his or her body language, posture, eye contact, and facial expression, and you use the same words and phrases in a conversation that other persons use. Poor communication is the core of many relationship problems, subject to conclusions. Trying to read minds and needing to be right are only few traits that doom communication. When people do not connect with each other in a meaningful way, their own minds take over relationship and many imaginary problems arises. Too often in relationships we have expectations and the hopes that we never explicitly communicate to our parents and colleagues. We assume they shouldn't know what we need and become disappointed when they don't accurately read our minds. Clear communication is essential if relationships are to be mutually satisfying. You're arbitrarily predict what other person's thinking and then react to the imagined information. Mind reading is often just a projection of what you think. Even after couples have been married for 30 years, it's impossible to them to always be right about what is going in the other person's head. Asking for clarification is essential to good communication. Having to be right. When a person has the right in a conversation, there is no communication, only a debate. Needing to be right destroys effective communications. Have a good attitude and assume the other person wants your relationship to work as much as you do. Doing as can to set the mood for a positive outcome. I call this having positive basic assumptions about the relationship. State what you need clearly in a positive way. In most situations, being directed is the best approach, but the way you ask is important. Decrease distractions. Tell me what you understood I said. Be a good listener. I hear you saying or you mean to say, and a gold standard of good communication. Doing this allows you to check out what you heard and before you respond. Monitor and follow up on your communication. It's important not to give up. I hear you saying, is that what you mean? As you can see, these are two completely different conversations. One is demanding and limits communication, while the other promotes communication and understanding. Active listening in relationship increases its level of understanding and communication. And when people feel understood by you, they feel closer to you. Begin practicing this technique on at least 2 people every day for a week. See if it doesn't increase your communication abilities and thus your ability to learn from others. Active and constructive, giving both authentic and enthusiastic enthusiastic support, active and constructive. Wow, that's amazing. Congratulations. Tell me all about it. In a healthy relationship, it's important to say what you mean. In that way, assertiveness and communication go hand in hand. Being assertive means that you express your thoughts and feelings in a firm yet reasonable way, not allowing others to run over you emotionally, and then not saying yes when that's not what you mean. Assertiveness never equates with being mean or aggressive. Do not give in to the anger of others just because it makes you uncomfortable. Anxious people do this a lot. They are so anxious that they are agree in order to avoid the tension. Unfortunately, doing this teaches others bully you to get in their way. We teach others how to treat us by what we allow in our lives. Being assertive in the face of another's anger doesn't mean you have to be angry back, but it does mean you don't agree with someone simply because you're uncomfortable. When you're feeling anxious about another person's anger, it is a good time to do a deep breathing techniques that I taught you earlier. Take a 3 deep and slow breaths and really think about what your opinion is, then state it clearly without much emotion. Say what you mean and stick for what you believe is right. People will respect you more. People like others who are real and who say exactly what's on their minds. Maintain self-control. Being angry means assertive is not being assertive. You can be assertive in a calm and clear way. Be firm and kind if possible. Above all, be firm in your stance. Again, we teach others how to treat us. So when they give in their temper tantrums, we actually teach them the way to control us. When we assert ourselves in a firm yet kind way, others can have more respect for us and will treat us accordingly. Now, if we allow the others to emotionally run over you for a long time, they're going to be resistant to change. If you stick to their guns, then you will help them learn a new way to relating to you, and the relationship will improve. Ultimately, you'll also be respect yourself more. Be assertive only when it is necessary. If you assert yourself all the time for unimportant issues, you'll be perceived as controlling, which invites an oppositional behavior. 수고했어요.